So again, good afternoon to everyone. Our last topic is in pathophysiology. It's all about the pathogenesis and pathognomonic sign. This topic is very relevant simply because it will give you information. You will gather or you will acquire the necessary knowledge, which may help you when you reach your third year and enrolled in the course Communicable Disease Nursing, because pathognomonic signs are very significant on identifying a specific disease. If we say pathognomonic, it's a sign that is only very peculiar on that particular disease or disorder. So then if we say pathogenesis, from the term itself, genesis, the patho is the disease and the genesis is the pathway. So as you have uh, processed before, a pathophysiology, from the risk factors up to the flow of the disease process until if it may lead to complications or may lead to mortality. This will give us the idea on how the physiologic process is related to the pathologic condition. So we have already uh, learned about the periods of disease, the diagnostic examinations, as well as with the chain of infection, which will be very helpful in terms of how you will process a pathophysiology, how you will formulate a pathophysiology. Our first slide will focus on specific concepts in pathogenesis when it comes to cause, incubation time, manifestation, and recovery. These are the common terms that are being used in the pathogenesis. So I have set here an example, which is a common cold. And it started with the cause. So we have discussed about non-modifiable, modifiable, precipitating, predisposing, perpetuating factors. So this could be causes. But in the case of individuals who may have the common cold, the exposure and inoculation of cold virus. So the virus that we're talking about in any type of virus that may be directed on a common cold, but specifically if for example, for a common cold, usually manifestations have observed that if any secretions, such as from the runny nose, if it will be subject for the culture and sensitivity test, it will identify the specific if it is bacteria. But for the virus, uh, these are very commonly known or identified specifically on the complete blood count. So for a common cold, we started with the cause when it comes to the exposure and inoculation of the cold virus. So meaning from if we will apply the infectious, we will apply the chain of infection. So this is on the stage of infection agent that will enter the reservoir. So we have the incubation time. In the periods of disease, if you have remembered the term period or incubation period, this is the time wherein it will significantly identify the initial entry, diba? The initial entry of the pathogens. The incubation time is also in particular when it comes to when the virus start to multiply. So when the virus start to multiply and it will not be controlled by any preventive measures or a direct treatment, it may lead to number 3, manifestation. So the host begins to have signs and symptoms such as sore throat, itchy eyes, and runny nose, etc. And once identified po ang signs and symptoms, so we have later on we'll differentiate what uh, signs and what are symptoms. Number 4, recovery. This is return to previous state of health. If we will try to connect this to the periods of disease, the recovery stage or period is associated with the period of convalescence. So another so a tip that is how we understand when it comes to pathogenesis, the cause, the incubation time, manifestation, and recovery. Let's have a situation. The client suspecting 2019 nCoV pa yung before. nCoV infection, person-to-person spread, which occur mainly via respiratory droplets, produced when an infected person coughs or sneezes, similar to how influenza and other pathogens, respiratory pathogens spread. Symptoms of COVID-19 may appear in few days or as long as 14 days after exposure. Symptoms can be fever, cough, shortness of breath. Client recovered out, or rather discharged, or rather recovers out from isolation room. If we will try to identify the cause, the incubation time, the manifestation, and the recovery. So let's start the cause. The cause is obviously the inoculation of the SARS-CoV-2. Okay? No, the first COVID-19 was identified with 2019 nCoV, but it evolved into the SARS-CoV-2, which is the COVID-19 infection. So the SARS-CoV-2 or the 2019 nCoV infection is the one, and the incubation time. So people try to consider the incubation time. The incubation time is the time or period wherein the virus will multiply. So very obviously we have 2 days up to the 14 days. So it covered the time. Kaya pag minention natin incubation period, when the virus starts to multiply, you will be observed. That's why those during incubation time, you will be subject to isolation or quarantine. When it comes to the manifestation obviously appeared here: fever, cough, and shortness of breath. And the recovery from the situation appeared that the client is outside the isolation room. Other than the pathogenesis, we have an example before as bird flu. So very familiar. The bird flu before is having a type A virus H5N1. So what is the cause? Obviously, excuse me, the cause of the bird flu is from type A virus H5N1. And upon inoculation of this virus, it will give us an incubation period. So what will be the incubation period? The incubation period for bird flu is the same as of the SARS-CoV-2 infection, which is 2 to 14 days. What are the manifestations? So the manifestations are fatigue, fever, conjunctivitis, sore throat, cough, and muscle aches. So if you will notice from the SARS-CoV-2 to the bird flu, which involved the respiratory tract, very common that usually it appeared in the upper respiratory tract infection, which is common yung cough, fever, and sore throat. Even with COVID-19, sore throat, cough, and fever are common to each other. Now, when it comes to the recovery, so obviously, if the patient do not have any more the symptoms, and it has been cleared from a test, from an X-ray or chest X-ray, then that will reach recovery. So actually, the reservoir of bird flu ay during the time, ayan, usually chicken, di ba? So sa mga poultry, usually na-identify ang bird flu. So they are the ones that are considered reservoir. Ang portal of exit ng bird flu is through the feces. Okay? It's through the feces Tapos, can you imagine from the pieces of the chick or the chicken, once it will be pulverized and it will suspended in the air, and you will inhale it, or either you touch it and the possibility to enter in the respiratory tract, that is the time that that it may inoculate the virus. So now we understand the chain of infection. It is the reservoir, who are the chicken, and now as it enters to the respiratory tract, so probably that could be a possibility aerosol for the mode of transmission. The portal of entry will be the nasal, and it becomes a new, rather a new host, which is the susceptible host, ang human. So similar lang, no? Similar lang yung concept na it could be associated with periods of disease, with the chain of infection and pathogenesis. Let us now consider that pathogenesis of a disease may be explained in terms of period. So it could be acute disease or chronic disease. For acute disease, usually the sudden onset, if we say onset, beginning, okay? The beginning time that the client experience a specific sign or symptom and had been diagnosed, this may possibly consider po na yung acute disease is starting. Yan, we associate the use of acute disease as starting. May mga starting naman siya or first time that the person have experienced pero sudden and severe. May situations like that. On the perspective, okay, when it comes to the chain of disease for the bird flu, so for the bird flu, the infectious, for example, the chain of infection, the infectious agent is the H5N1. Then the reservoir are the chicken. Tapos the portal of exit is the feces, okay, feces of the infected chicken. And once it pulverized, the mode of transmission will be aerosol. So by air, by aerosol. So the portal of entry will be inhalation, so respiratory tract, then susceptible host. So that is again the chain of infection as identified in bird flu. So going back to acute disease, in acute disease, as what I have mentioned, that it could be sudden, it could be severe, it could be short. So usually ang mga common for acute disease are high fever or severe pain. So if you will notice for appendicitis, very sudden ang experience of pain. Yung pain that the person will will experience, it will not start from mild to moderate. Usually the pain is severe. So you were in, it will not pass through from the level or stages. Just like for fever, agad high grade fever. So this could be identified as periods of disease. Now, when it comes to the chronic, how about for the chronic? So we have already used this chronic disease as a long term, sometimes reoccurring. Those examples that we mentioned, for example, the rheumatoid arthritis. So the rheumatoid arthritis will be triggered accordingly for a certain cause. Just like for gouty arthritis, if it will trigger uric acid, which is anytime it will be triggered, pain will be experienced by the person. So it's beyond his control. Yung risk is probably long term. Unlike for example, dun sa acute disease, when the person experienced the severe pain and acute appendicitis was identified, and the patient will undergo appendectomy, then eventually this will consider po the effect of a long-term treatment. So anything that is considered for long-term treatment, such as maintenance, okay, those who are taking maintenance drugs, those who are taking therapy for lifetime to support and to sustain functions of organs, So example natin diyan, dialysis, chemotherapy, radiation therapy. So most of the immunocompromised immunocompromised conditions. So just like myocardial infarction, ang myocardial infarction anytime pag first attack yan, heart attack, and risk ka na, chronic na yan kasi the next is you could be at risk of the second heart attack and more. So this explains chronic disease. Now, how about idiopathic? Okay? If we say idiopathic, the term or the disease is associated with unknown cause. Usually this is used. So just like for example, acute idiopathic polyneuritis. Although we have used acute, it's a start of or onset. It could be severe. Idiopathic, unknown cause. Polyneuritis from poly, multiple, new nerve itis inflammation. So there is an acute multiple nerve inflammation of unknown cause. So that is what we call the use of idiopathic. Another is we have used the what we call skeletal hyperstosis. So obviously the involved organ here is the skeletal system. Now, in the perspective of the skeletal hyperostosis, pag sinabi natin kasi, if we say hyperostosis, this is usually associated with excessive growth of bone. Okay, usually these are associated with musculoskeletal disorders. So, pag ginamit naman natin yung diffuse, in excess, okay, excessive, diffuse, skeletal, what do you call this, hyperostosis, so excessive growth of bone but of unknown cause. So you can now associate always that if there's a diagnosis of idiopathic, it's of unknown cause. Example, idiopathic pulmonary fibrosis. So pag if we say pulmonary fibrosis, so obviously idiopathic, unknown, pulmonary, respiratory, and if we say fibrosis, this is associated just the same as for the cystic fibrosis that we have discussed. Fibrosis is there will be an excessive production of mucus secretions, but of unknown cause. Another example that we have used idiopathic is idiopathic scoliosis. So there is an arcing of the skeletal stature, but it's of unknown cause. So that is how we use the term idiopathic. How about iatrogenic? Usually, iatrogenic disease is an outcome or result of a particular or prescribed treatment. So, just like for example, when we use Cushing-like syndrome as a result of steroid therapy. Okay? So, if we say Cushing syndrome, usually the body, di ba sabi ko sa inyo when we discuss stress, ang stress lalong nagpo-produce yan ng cortisol. At usually pag nagpo-produce ng cortisol, ang cortisol are being produced by the adrenal cortex. Okay, the adrenal cortex. But too much increase in the production of the cortisol, it may cause naman immunosuppression or may decrease the immune system. So usually, Cushing-like syndrome happen if the person is taking steroid therapy. So meaning, if the person is on steroid therapy, which is the prescribed treatment, the person may have Cushing-like syndrome as the result of the prescribed treatment. Now, when we consider po immunosuppression, when it comes to immunosuppression or anemia as a result of chemotherapy. Okay, chemotherapy is the prescribed treatment, and what is the result? the result sometimes leaded to immunosuppression or anemia, because we all know that the chemo drugs may also kill or suppress healthy cells. So, ang tawag po dyan, iatrogenic disease. Another, a person who are taking salicylates. Ang mga salicylates, ito po ay aspirin, yung acetyl salicylic acid or aspirin, or taking corticosteroids, may have an ulcer. So, di ba, most of these drugs may cause hyperacidity and possibly may cause irritation of mucosa and peptic ulcer. So, what's the result of the peptic ulcer? It's because upon taking of the steroids and salicylates. Parkinsonism. So, sa Parkinson's disease, we have identified that the patients or individuals experiences tremors, and usually tremors could be the result of antipsychotic drugs. So, steroid therapy, the patient may have Cushing-like syndrome, which eventually resulted from the increased cortisol. Then, immunosuppression or anemia as a result of chemotherapy. Peptic ulcer as a result from the salicylates and corticosteroids, and Parkinsonism from antipsychotic drugs. So that is what we call iatrogenic, idiopathic, unknown, iatrogenic result from prescribed treatment. Usually the one that was acquired, ito naman, kasi meron tayong community acquired, if you will encounter it, community acquired and hospital acquired. Okay? Usually, in a clinical setting such as hospital, it is hospital acquired. For example, the patient entered the hospital and was not identified with specific infection, and the patient developed the infection in the hospital, then that is hospital acquired. Then, if, for example, the patient prior to hospitalization was diagnosed with pneumonia, then that is community acquired. So, when is the time that nosocomial disease will be used? If, for example, the infection, the disease has been acquired from a clinic, from the hospital, so that is what we call hospital acquired or nosocomial infection or disease. So usually, for example, postoperative patient, so from postoperative patient, the patient developed an infection because surgical instrument was not properly sterilized. Yan, nosocomial infection yan. So ibig sabihin, or nosocomial disease. The patient developed an infection because of a certain cause that is within the hospital premise or the hospital equipment or supplies that are used. Another is the child develops cold after being exposed to other children at the pediatrician's office. So this is considered also as nosocomial disease because the patient or the child developed the specific manifestations during the exposure in the hospital or in the doctor's clinic. So possibly the patient acquired it because of others who are also infected by colds. So those are nosocomial disease. Now, when we talk about manifestations, these are the clinical presentations of signs and symptoms. Sometimes we associate this manifestation as only signs. Sometimes it is used as symptoms. If we say manifestations, these are both signs and symptoms. And usually these are the clinical evidence on the effect of disease. So I have a question here. Dean, ask lang po, for instance, nosocomial disease, are the clinical setting be held accountable or normally hindi na po? Kunwari po nag-lead sa death, to death yung infection. Actually, the hospital could be accountable first and foremost if the infection was proven, okay? First, was proven that it was developed in the hospital or acquired in the hospital. Second, is there could be instances that the hospital will be accountable or liable if no immediate medical attention or care was given during the time of existence of nosocomial infection. Then if this happens, that it did not attended to the concern of infection that was developed during hospitalization or in any clinics, then hospital will be accountable to it. So if ever, kasi there are also instances na the patient already developed the infection because primarily and initially the person is suspected to have the type of infection. It's just awaiting for a confirmatory diagnostic evaluation results. But for example, the patient who is post-operative, who is not known to have pneumonia, for example, have not having pneumonia, tapos the patient developed pneumonia after the operation. So how it happened? So that will be a big question, that the patient developed pneumonia, which is not related to the post-surgical condition. So if those questions will arise and if those questions will be raised, then it could trace somehow the person or the person's accountability to respond clearly. If it's not clear, then investigation will be considered, and possibly the accountability comes in if there is already identified problem that really arise and clearly arise as the cause of infection. So I know that you have been oriented when it comes to the local manifestation. We have the local manifestation and we have the systemic manifestation. If we say local manifestation, from the term itself local, usually the manifestation is only found and present on the specific site, localized. Kaya pag sinabi ko nga sa inyo ng localized anesthesia, anesthetic effect will happen only on a certain part where anesthesia had been introduced. So just the same as pag sinabi natin local manifestations, signs or symptoms may only be identified on a specific area. Usually the response, this is usually a response of an injury or an irritation. Usually yan, redness, swelling, abscess. Abscess is pus. Cellulitis are significant when it comes to inflammation. Okay, so these are the common localized manifestation that can be identified in specific area. If we say systemic circulation, or rather systemic manifestation, these are usually indicators that may affect the whole body, and may not specifically identify initially of specific organ or system that are affected. Just like, for example, if the patient has fever, you cannot identify of what part or organ or system has been affected by fever. So general siya. Lethargy is a condition wherein this is a state of decreased alertness. A state of decreased alertness. So alert is the highest from the level of consciousness, then it becomes lethargy, or if the person is drowsy, which is an indication of decreased oxygen supply to the brain. However, this could be generalized kasi what is the cause of the lethargy or drowsiness of the patient? It may not be directly from the brain. It may possibly come from the heart, because if there is decreased cardiac output, the brain will be affected. Another is systemic manifestation could be general body aches. Kasi sometimes when you will ask the client, masakit po ang katawan ko. What part? Usually we will hindi buong katawan ko. So yan, papasok dyan si systemic manifestation, but you cannot identify specifically what part of the body or system are involved. Just the same as for general weakness. Okay, so that is local manifestation and we have systemic manifestations. So I know you are familiar with this because we have mentioned that signs is different from symptoms, because usually signs are based from observations, based from evidences. Okay, it could be evidences just like vital signs, just like results of diagnostic examinations. So that's why it used the term obvious. These are indicators that gives you already a reference after taking a specific vital signs to the client. Kaya nga siya vital signs. Signs itself will give you information. So a typical example, temperature, blood pressure, respiratory rate, abnormal heart sound. So dito sa signs, actually ito incomplete pa nga yung mass na yan eh. Usually dapat if you considered mass, palpable mass, yan, pwede yan. Palpable, movable mass, location. So that could be sign. And large organs could be sign if this could be a result of chest x-ray. For example, cardiomegaly. So edema could be considered as sign if it will use edema grading. Grade 1, grade 2, grade 3, grade 4. And edema grading is used depending on the depth of the edema. Kasi pag sinabi natin ang mini-measure dito na edema is the pitting edema. And usually ang pitting edema or in Tagalog, manas, is merely identified accordingly once you assess dun sa pinaka-dorsal aspect of the foot. Pag ang cause ng edema is accumulation of fluid, obviously it will not return. It's not elastic. So you can measure the depth, and upon measuring the depth, it will give you the edema grading. And once you have the signs, you must have the edema grading scoring. Next, how about for the symptom? For the symptom naman, it's the patient's awareness, abnormalities. So usually these are, kung observable for signs, subjective naman yung perception. So usually this will be asked to your client. So just like pain. Pain, for example, you have the pain scale. That's why you will ask the client. Nausea, definitely you will ask the client of the history or possibly the other description, the specific description of the patient is experiencing. Weakness, kaya dito kung weakness, it's a symptom because it will be verbalized by the client. Fatigue, dizziness, and drowsiness. These are symptoms. Actually, this could not be measured. Kasi pag sinabi mong dizziness, gaano pong dizzy? Dizzy na dizzy, not dizzy, or sobrang dizzy. So hindi naman we cannot measure dizziness eh. Drowsiness, o pag sinabing drowsiness, nahihilo po ako. Anong level po ng drowsiness? There's no such. Kaya pag sinabi nating weakness, o anong weakness? May body weakness, may left side na weakness, merong lower extremity na weakness. So this will depend on the patient's perception on the type of manifestation. Next, I know you have been familiar with asymptomatic. So pag sinabi nating asymptomatic, obviously no signs. Pero class, remember, even the person or individuals are considered as asymptomatic. They may still be considered as reservoir or carrier. It so happened that the body of the person can control the multiplication of the pathogen. So that's why symptoms are not recognized. Pero they are still considered as carrier. If we say self-limiting disease, a disease that does not require treatment. Okay. Ano po yung does not require treatment? Example, if the patient has chickenpox, do a doctor will advise the client to be admitted because of chickenpox? No, because chickenpox is self-limiting disease. If you say self-limiting disease, you just need to isolate in just 2 weeks after appearance of rashes until you recovered. So yun po yung self-limiting disease. Measles then, no treatment ang measles, although may have the vaccine. Pero kung hindi vaccinated yung patient and the patient experienced the measles, these are self-limiting diseases. Kaya these are some conditions that are not subject for admission in the hospital. Okay. Question, self-limiting din po ba ang singaw? Kasi pag sinabi nating singaw, Singaw is considered as a sore. So the singaw ba is referring to the singaw sa mouth sore. So ang mouth sore po kasi, pag sinabi nating self-limiting, kusa siyang gumagaling. Okay? Kasi yung na-mention ko kanina about chickenpox, about measles, these are caused by the virus. And there's no need to hospitalize because it will just continue a healthy nutritional management as long as for example, if it is newborn, as long as the newborn is having a good sucking reflex. So most of the self-limiting diseases are the ones that will recover in a way that may not subject to treatment, unless just like now, if the person may have the chickenpox, usually they are asked to have acyclovir because it's an antiviral drug, so that to not to aggravate the level of severity of the condition. Ang singaw or ang mouth sore, we cannot say that it's a self-limiting disease kasi hindi siya disease. Okay? Mouth sore could be a manifestation. Okay? And a presence of mouth sore will be considered as signs kasi specific yung location at yung itsura. When you describe it, that can be considered as signs. Okay? Next po. Next, let us now proceed with pathognomonic sign. Okay. If we say pathognomonic sign, these are the signs that had been identified particularly in that disease only. Okay? So, usually the pathognomonic sign represents a marked intensification of diagnostic sign or symptom, meaning it will give you parang it will give you confidence na it's a pathognomonic sign. So suspecting that the patient may have measles, the patient may have polio, the patient may have mumps. So particular if you had encountered that, ay baka ano yan. So yung mga ganon. So it may direct to that perspective. Yan po yung tinatawag nating pathognomonic sign na very peculiar or particular lang to that certain disease. Okay? So let us start with this. Okay? We have abdominal aortic aneurysm. Okay? Class, if we say aneurysm, usually involved sa aneurysm ay ano? What organ ang involved sa aneurysm?
Brain.
Brain could be, but what part of the brain is involved specifically? Kasi pwede rin sa ano yan eh, pwede rin hindi sa brain eh. Pwede rin sa ibang part ng body. Anyone?
Subarachnoid space.
Subarachnoid space could be, okay? It may not be particularly space, but if we talk about aneurysm, it involves
blood vessels.
Yun, thank you Miss Arbo. It's blood vessels. Kasi once nagko-cause ng loose ng elasticity yung blood vessel, nagke-create siya ng pouch. Can you imagine the blood vessel pag nag-loose yung epithelial lining siya, nagke-create ng pouch, doon nag-accumulate yung blood. At doon may possibility na pag na-accumulate yung blood doon sa pouch na yon na nag-create, yung imagine niyo yung balloon na elongated. Tapos pag pinrest mo, nagke-create siya ng another shape. So yun yung pouch na kine-create pag nagko-cause ng pressure sa blood vessels. So and sometimes you may not know, it's very sudden. Pag nag-aneurysm, very sudden talaga ang deterioration ng alertness. Mawawalan ng malay tapos you will be comatose. And because kasi there could be a possibility that pag nag-lose kasi yung elasticity ng blood vessels at nag-pouch yan, nag-accumulate din yung blood. So may possibility bang mag-rupture yung blood vessels? That is yes. Once mag-rupture ang aneurysm, then magkukos ng bleeding. So that's what happened when we are talking about cerebral aneurysm. Ito naman is abdominal aortic aneurysm. So yung blood vessels dito obviously ay involve ang aorta. At ang aorta, di ba connected yan sa systemic circulation. So, ano po, sir, ang pathognomonic sign pag merong AAA, dito triple A battery AAA, pag naka-encounter kayo, abdominal aortic aneurysm. At mapapansin ninyo, even without palpating, yung abdomen ng pasyente, yung abdomen ng pasyente nakikita nyo nagpo-pulsate. May mass siya, tapos nagpo-pulsate. Tender yung abdomen, tapos nagpo-pulsate. So yung ibig sabihin ng nagpo-pulsate, kitang-kita mo yung appearance na nagpo-pulsate yung blood vessels at meron doong mass. Tapos nagpo-pulsate siya. So that is an indication of pulsating abdominal mass. From the term it's pulsating. So very very prominent yung pag-pulsate. So parang dito, 'di ba? Sa carotid artery pulsation, even minsan pagka kulang yung oxygenation sa brain, 'di ba usually we check yung carotid pulse kasi eventually this is the pulse that supplies blood to the brain. Kung nakikita mo yan na pulsating kahit hindi mo palpate, that's an indication of depriving blood supply to the specific organ. So just similar with this, pag nagpo-pulsate yan kahit hindi mo siya pinapalpate yung blood vessels, that is a worse condition. Okay, remember that So that ang pathognomonic sign nito ay pulsating abdominal mass. Next po ay Addison's disease. Okay? Ang Addison's disease po ay identified sa problem sa adrenal. So pag sinabi nating adrenal, this is usually a problem with kidneys. Okay? So dito naman ang Addison's disease, ang problem nito ay adrenal insufficiency. Ibig sabihin, there is a decreased perfusion or circulation sa kidneys and at the same time, decreased production of cortisol. So, di ba ang cortisol, very important to as a natural anti-inflammatory substance. Kaso, hindi siya nagpo-produce. Yun yung problem. Decrease ang production ng cortisol. Yun ang Addison's disease. At ang common, okay? Ang common ang pathognomonic sign ng Addison's disease ay bronze skin pigmentation. From this illustration, this is the normal color of the skin. But if you notice on the left side, this is the bronze skin in pigmentation. Kaya tandaan po ninyo, usually pag mga nagbo-bronze skin ang pigmentation, always it is associated with kidneys. Have you observed individuals who are on ongoing dialysis? Yung color of the skin nila, yun yung common sa mga may kidney problems. Pag darker, the darker yung color ng skin ng patient and it looks like bronze, Addison's disease po yun. So pathognomonic sign siya. Kaya pag nakita nyo, nagpo-pulsate yung abdomen, baka ano na yan, AAA, abdominal aortic aneurysm. Okay, you have observed. There is a client who have the bronze skin pigmentation. So first, you will think that the patient may have kidney problem. Second, the thing that you will think the patient may have adrenal problem or adrenal insufficiency. Third, you will think that the patient may have hypocortisolism. So through that observation of pathognomonic sign, you can now direct yourself of the suspecting or working diagnosis of the client. Next po, amoebiasis. So familiar naman tayo sa amoebiasis na nakukuha ito sa contaminated yung mga contaminated na food or contaminated po na water. So ang problem with amoeba, usually ang amoeba ang tina-target niyan intestinal. Pagkatapos, ang next na tina-target ng amoeba, liver. Kaya nakakatakot na pag ang amoeba ay pumasok sa liver kasi magko-cause na yan ng damage sa liver. So usually check po ninyo if kung ang stool, okay? Kung ang stool ng patient natin ay bloody mucoid. Pag sinabi nating mucoid, what does it mean? If we say mucoid, what does it mean? Anyone? Pag mucoid, anong description yon pag mucoid? Anyone? Mucoid. Pag sinabi natin kasing pag sinabi kasi nating mucoid, can you imagine the stool with blood? Okay? Stool with blood and passes through. So posible yan amoebiasis. At yon ay an indication, that is an indication that the amoeba is damaging the intestinal tissues. Okay? So tatlo na 'yung na-identify natin ha, na pathognomonic. Pag nagpo-pulsate may mass sa abdomen, nagpo-pulsate siya, abdominal aortic aneurysm. Pag ang color naman, okay, hands, extremities, ay bronze skin pigmentation, Addison's disease. So sinabi natin that Addison's are problems with kidneys, specifically adrenal insufficiency and decreased high cortisol level. Pag amoeba, bloody mucoid stool. Let us now proceed to the next. Sa next naman, angina pectoris. Ano naman ang angina pectoris? Angina stands for chest pain. Pectoris, it radiates to the different parts of the body. Okay, now, for a person who is experiencing yung hand clutching test, ano ibig sabihin ng hand clutching? Ganyan. Hand clutching chest. Ganyan, di ba? Pag sumasakit ang dibdib, hand clutching chest. Ang tawag po dyan ay Levine sign. Positive Levine sign. Pag nag-chest pain, tapos clutch yung hand at the chest, Levine sign. Ang tawag dyan, the patient is already starting to have angina pectoris. Okay? Next po. Appendicitis. Very common. Very common. Most dyan, sasabihin ninyo, pag merong inflammation of the appendix, usually sasabihin yan, ang pain nandito sa right lower quadrant. Okay, right lower quadrant, correct. But how will you check if the patient has possible appendicitis? Dalawa po. Okay? There are two things that you can check as pathognomonic sign sa pasyente. First is we have Robsing sign and the other one is psoas sign. Okay, kaya pag mayroong right lower quadrant pain, gawin nyo na to. Ang Robsing sign is you will palpate the left lower quadrant pain. Ang pain is in right lower quadrant. So ang ipapalpate mo sa left. Okay? 'Di ba usually ang pain niyan, ang appendicitis, ang pain sa right lower quadrant. So ipapalpate mo yung left lower quadrant pero nagra-radiate yung pain, nag-a-appear prominent sa right lower quadrant. 'Yon ang tawag doon Robsing sign. Okay ha? So ipapalpate mo yung left, tapos saan po masakit? Nagsasabi yung pasyente and address to you, masakit po yung sa right. Mas masakit po yung sa right. Siyempre, pag i-press mo, masakit. Pero pag pinress mo to, pero mas prominent and dominant yung sakit sa right lower quadrant, Robsing sign. Ano naman yung psoas sign? Ang psoas sign naman po is ipeplex nyo yung thigh. Okay? Ipeplex nyo yung thigh hanggang chest. Tapos pag pinlex nyo yung thigh to the hip, very severe pain. Okay? Sir, i-flex ko lang po yung i-flex ko lang po yung thigh nyo ha. Aray. Ayan. Psoas sign ang tawag doon. Kaya pag sinabi mo sa doctor, Doc, the patient has positive Robsing sign. Upon palpation to the left lower quadrant, it radiates to right. The patient has psoas sign because when I flex the patient's thigh to the hip, the patient complained of pain. So dalawa pag appendicitis ang problem. So let's have a question. Sir, yung Robsing sign po ba, yung right lower quadrant naman, pinress sa sakit din ang left? Hindi po. Kasi doon prominent yung pain sa right lower quadrant So to validate it with the Robson sign, ang palpation talaga sa left lower quadrant. Pero on the other hand, pag reverse mo, hindi sasakit. Pag sa right ka nag-press, hindi sasakit yung left. So prominent lang ang Robson sign. Pag left lower quadrant, prominent and dominant, nasasakit yung right. Okay, kasi di ba obviously pag nag-press ka sa left, dapat left yung sakit pero mas prominent na nagra-radiate yung right lower quadrant. Another question. Dean, nakasupine po ba yung patient while doing the SOA sign? Yes po. Nakasupine po yung patient. Tapos i-flex nyo yung hips, yung thigh to hips. Pag pinlex nyo, not necessarily not necessarily pareho. It could be either right or the left. Pagka pinlex nyo po yon, tapos nag-pain na siya, SOA sign. Takbo na agad yan sa ospital. Kaya that's why when you are considering, i-check nyo muna yung Robson sign at saka yung SOA sign. Pag nag-positive pareho, pathognomonic sign really help. Kasi diagnostic test can really attest yung problem. Pero yung initial na observation natin of pathognomonic sign na very common lang for appendicitis, ayan, yung Robson at saka SOA sign. Okay, next po. Next po is yung basilar skull fracture. Skull. Okay, basilar skull fracture. Pag basilar skull fracture naman po, so obviously it's a skull injury or fracture. Ang manifestation naman itong basilar, mamaya ipapakita ko, meron akong photo diyan eh. Basilar skull fracture naman, raccoon eyes, parang Ravenna. Raccoon eyes, ang tawag doon po kasi ay ecchymosis. Pag sinabi nating ecchymosis, alam nyo yung blood na namuo sa tissue, nangingitim, yon. Yung blood na namuo sa specific tissues, yon ang tawag doon ecchymosis. Pero usually ang ecchymosis is different from it's different from pasa. Meron kasi 'di ba na ecchymosis na hindi siya fully yung fully dark, nakikita nyo meron parang green, red, yung usually pag mga injuries, yun usually pagka accumulation of blood to tissues, ecchymosis ang tawag diyan. So dalawa yung kino-consider natin dito, raccoon eyes. So yung raccoon eyes, periorbital ecchymosis. Pag sinabi natin periorbital, ito, periorbital. So makikita mo diyan yung pangingitim sa mata, na palibot dun sa mata. That's raccoon eyes. Kaya pag may nakikita kayo diyan, kasi ang eye bags lang naman dito eh. So imagine niyo yung eye bags, buong buong periorbital. Yung from sinabi natin periorbital, buo, umikot siya. Ay, ang tawag doon raccoon eyes. Ay, raccoon eyes pala yun. So baka may fracture. So the other one is we have the battle sign. Yung battle sign naman, mastoid ecchymosis. So nasa ng mastoid dito, di ba? So mastoid ecchymosis, dun yun naman makikita yung specific na accumulation of blood into tissue. So later I'll give you a photo. I'll present you a photo. But for the meantime, I think I have a question dito. Ay, okay na. So it was just a response of appreciation. Next, Buerger's disease. Ang Buerger's disease po ay problem with blood vessels. Ang Buerger's disease ay usually are also called as thromboangiitis obliterans. Ito po ang problem dito, blood vessels are inflamed. Okay? So if you will notice in this illustration, this is the normal blood vessels. Ito yung inflamed blood vessels. Pag inflamed yung blood vessels po, nagkukos ng thickening of the epithelial lining. Kaya pag nagkukos ng thromboangiitis obliterans or Buerger's disease, makikita nyo po yung hands, yung pinaka-tip ng fingers ay nagkukos ng pangingitim. Because eventually, the circulation is not reaching this point. Yan po yung tinatawag nating Buerger's disease. So nakikita natin sa hands that there is intermittent claudication. Pag sinabi natin intermittent claudication, ayan, intermittent. Nakikita nyo tapos there is a dark colored discoloration, rather a discoloration on the tip kasi hindi nare-reach ng circulation. Okay, so let's proceed to next. Ayan ang raccoon eyes. Ayan ang tinatawag nating raccoon eyes. If you will notice, ayan, si basilar skull fracture, ayan yung itsura ng ecchymosis. Usually, ang ecchymosis po ay may bleeding underneath. Okay, bleeding underneath tissue. Usually yan pag mga bruising, yan bruises usually when we associate with bruises. Ito yung ecchymosis. So, ayan po ang tinatawag nating raccoon eyes. Ang tawag po doon ay raccoon eyes periorbital ecchymosis. At ang mastoid ecchymosis, yan dark naman pero naka-appear naman siya sa may battle sign sa may mastoid area. So, okay. So, since it's 6:30, so we may have a break first for 15 minutes before we continue. And you may have your hydration, stretch your extremities, and meet your physiologic needs. We'll be back after 15 minutes. Thank you. Okay, so let us continue. The next discussion will pertains to bulimia nervosa. Actually, bulimia nervosa is an eating disorder. So, uh, the person will eat and eat, but at the same time, the person who eats much will vomit, but it is induced. So usually ang mga patient with, 'di ba, familiar ka ang kabaliktaran kasi ng bulimia nervosa, yung talagang they do not eat. Anorexia nervosa. Yung this is what happened to, I don't know if you know Karen Carpenter. Yung talagang siya yung hindi na talaga kumakain. Ang bulimia nervosa naman, kakain siya ng kakain, the person will continue to eat, pero iaano niya rin, ipipilit niya rin na i-vomit. So, usually ang pathognomonic sign ng bulimia nervosa ay chipmunk face. So, siguro naman familiar kayo sa chipmunk face. So dito ang itsura niyan, there is parotid gland swelling. Alam niyo yung parotid gland, 'di ba? Pag parotid gland yan yung sa mumps. So pag may ano yan dito, yung mukhang chipmunks. This may have the parotid gland swelling, bulimia nervosa dito, swelling of the parotid gland. Tapos Russell sign. Ano yung Russell sign? Ang Russell sign, 'di ba ito, ang tawag dito knuckles. So, if you will notice, ang mga knuckles nila may scrape yung raw areas, scrape. Kasi for them to experience yung induced vomiting, nagse-self-induce nila, pinapasok nila yung buong fist. Pinapasok nila yan. So that's why yung dito sa knuckles ko-contact doon sa ngipin. So yung pinaka-prominent na bone dito, yung knuckles, yun yung nagko-cause ng mga scrape tissues. So ang tawag doon, Russell sign, self-induced vomiting. Pinapasok niya yung buong fist niya sa bibig tapos ibabamit niya rin yung kinain niya. So chipmunk face or parotid gland swelling and Russell sign for bulimia nervosa. Sa mga carbon monoxide poisoning naman, usually ang problem naman nila ay ang problem naman nila is basically cherry red. Hindi naman, ang pathognomonic sign nito cherry red face. So nagma-manifest yan sa facial. Na, siguro naman familiar kayo with cherry, yung usually pagka nakikita niyo yung fruit sa ibabaw ng ice cream, cherry po, the cherry red itself. Yun ang makikita mo sa facial feature pag carbon monoxide poisoning. Ito yung mga situations na yung mga nalalak sa loob ng car tapos nasusuffocate sila. Either nakabukas ang aircon tapos matagal silang naka-station na nakalak dun sa car. Carbon monoxide poisoning ang usually nagiging doon. So pag nag-leak yung merong defect dun sa loob ng car, so ang umaano doon yung carbon monoxide. So question, din may ganun po palang kalaki? Yes. Actually, hindi ganun kalaki, pinipilit nilang ipasok yung face nila kasi nga they really wanted to induce vomiting. So self-induced talaga. They will eat and eat and eat pero ibabamit. So that's bulimia nervosa. So cherry red face naman pagka carbon monoxide. Next po. Ano naman yung cardiac tamponade? Yung cardiac tamponade sa iba naman tamponade. Okay, pero tamponade ang alam ko. Cardiac tamponade, ang tatandaan nyo dito, Beck's triad. Sir, ano yan? Anong Beck's triad? So tatlo. Beck's triad ang tatandaan ninyo. So pathognomonic sign, Beck's triad. Pag sinabi natin kasing cardiac tamponade or tamponade, yung, di ba ang heart, naka-cover dyan si outermost covering ng heart, pericardium. May pericardial sac dyan. Parang sa lungs, may visceral tissues, may pleura. So sa heart naman, meron yan pleural sac. Ang ang nagiging problem with cardiac tamponade or tamponade is yung fluid nag-accumulate dun sa space. So pag nag-accumulate sa space yung fluid, nako-compress mismo yung heart. So ang tatandaan nyo ay Beck's triad. First, low blood pressure. That's 1. 2, distended neck veins. Distended, kahit hindi mo palpate, kita mo na talagang galit na galit ang neck veins. Distended neck veins. Third, muffled heart sound. Ano ibig sabihin ng muffled heart sound? 'Di ba you will have the heart sound lub dub lub dub. Yung meron lub tapos ina dub. Dub lub dub lub dub lub dub 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 dub. Hindi yung lub dub lub dub lub dub. Hindi ganon. It's lub dub 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 dub. Yun, muffled sound, heart sound. So 3, muffled heart sound, low blood pressure, distended neck veins, Beck's triad. That's cardiac tamponade. Din magkaiba ba? Yes, magkaiba po ang anorexia sa bulimia. Si anorexia totally hindi siya kumakain. Kaya nga pag anorexia ang term doon loss of appetite. Anorexia nerbosa, hindi talaga siya kumakain. Ang bulimia naman, kumakain siya ng kumakain, pero nag-i-induce ng vomiting. Mga eating disorders nga eh. Although these are these are psychological, pero under na rin kasi yan sa sa mental concerns natin or deviation. So magkaiba po si anorexia nervosa, magkaiba po si bulimia nervosa. So next po, carpal tunnel syndrome. Ayan. Ang carpal tunnel syndrome ay very common sa mga Saan common po ang carpal tunnel syndrome? Common po siya sa yung mahilig sa gadget most of the time. Ayan, parating working ang hands. Pero usually yan, ang mga carpal tunnel, usually laptop, gadget. Kaya somehow, pag kayo ay nag-carpal tunnel syndrome, dalawa po ang pathognomonic sign niyan. Ang first niyan ay tinel sign. Yung tinel sign po, what you will do, ito yung nyo, ayan, ganyan. So pag pinrest nyo ito, sana makita. Okay, the sign that the nerve is irritated. So ito, pag pinrest nyo dito, this one, yan, pag pinrest nyo, press yung nerve ha. The nerve is, makaka-feel kayo ng parang pins and needles. May tingling. Ngayon wala ako wala akong nararamdaman. Pero pag naramdaman ninyo yung parang may tumutusok, tapos tingling talaga siya, yung pins and needles ang mararamdaman ninyo, that's pathognomonic sign. Yan sa carpal tunnel. Ano naman yung Palens test? Yung Palens test naman po ay eto. Ang Palens test naman, i-check nyo yung either may tingling or may numbness. What you will do is ang Palens test, yung positive, for example, ganyan. Okay? So pagka chinek nyo ito, na yung flexion of the wrist ninyo, nagkakaroon ng tingling or pain. Symptoms of tingling or pain. Masakit. Masakit siya. This is Palens test. Or on the other hand, if it's not in this way, you will do it in this way. Masakit. Magkukos talaga ng severe pain at posibleng numbness. So yun po ay carpal tunnel syndrome. Yung tinel sign, okay, yung tinel sign, you will press the nerve, tapos may pins and needles. Or once you do it, yung flexion ng wrist, it will cause or produce pain. Next po, cataract. Ang cataract naman po, ang pathognomonic sign ng cataract ay cloudy vision. So what do you mean by cloudy vision? Ang cloudy vision po ay usually yan malabo yung paningin ng person, pero minsan pag cataract makikita nyo na talaga yung makikita nyo na talaga dun sa mata na mayroong white pigmentation. Iba si glaucoma. Si glaucoma kasi blindness na ang problema eh. Si cataract, ang nakikita niya not clear. So parang parating may usok. Yun ang nakikita niya cloudy. So cloudy vision siya. Ano naman yung cerebral palsy? Ang cerebral palsy is associated, di ba, with the direct damage or problem with the brain, di ba? Cerebral palsy. So ano po ang tinatawag nating cerebral palsy? So ang cerebral palsy usually ang affected po sa cerebral palsy ay mobility. So ang usually pag may cerebral palsy, pag sinabi nating scissor gait, alam mo 'yan, di ba scissor gait? Pag naglakad sila, ang usual lakad ay ganyan. Pero sila ganon. Ang lakad nila ganyan. Scissor gait. Lumalakad-lakad sila ganon. Yan, scissor gait. Cerebral palsy. Okay. Next po. So this will be the last. It's already 7 o'clock. Chicken pox. Okay. Sa chicken pox naman, ang lesions nito, last tatandaan ninyo, usually ang chicken pox, ang pathognomonic sign niyan, ang rashes nag-start sa chest lagi. Okay? Pag nag-start sa chest, tapos ang rashes niya ay vesiculopapular. Ano ibig sabihin? Plus, pag nadidinig nyo yung papular rashes, protruded siya. Ang macular rashes, flat. Parang sa mga measles. Okay? Rashes, di ba? Pagka popular, ang popular rashes po ay naka-protrude or naka-occlude. Yung chicken pox, naka-protrude siya, meron pang fluid. Okay? Yon ay vesiculopapular. Protruded, may fluid pa. So usually it starts with the chest. It starts with the chest at pa-spread pa outward. Tsaka siya kakalat. Okay? Pag kumalat siya outward throughout the extremities, that is chicken pox. So probably we'll continue our discussion na po on Monday. Very short na lang po ito. And probably I'll just give an announcement if I may give an assessment exercises po. So I think I need to manage a question. Bakit po sa ngala-ngala nag-start yung bulutong po kaya in-inject po sa akin yung vaccine? Ganito. Ngala-ngala. So kung nag-start siya, ngala-ngala is dito, 'di ba, sa palate. Probably kasi pag ang chicken pox talaga chest usually 'yan. Ako majority chest talaga nag-i-start and outward. So posibleng hindi man siya or minimal yung nag-appear sa chest, probably kasi the other mucosa doon nagra-rupture yung doon nagpo-protrude yung rashes. And that may affect naman pag nag-chicken pox ka, hindi lang naman sa labas eh. Hanggang dito yan sa oral mucosa, papasok. Kaya very irritating talaga din sa throat. Okay? So probably we will continue on Monday. So expect for a quiz